It's all over the headlines. Should you be opting out of the hepatitis B vaccine for your newborn, which you should know before you make that decision? Did you know that your state may be on the naughty list this year? And what are the surprising and concerning responses of ACA enrollees as the reality hit that these premiums are definitely going up? And which new Black mom whose video went viral of her ill treatment in labor is now the inspiration of a new law to change the experiences of all pregnant women? As we embark on the busiest travel season, what TSA changes you should know about? And who's trying to put doctors in jail? Now you know I have something to say about that. Hey, you guys, thank you for hopping on and joining me today. We are so glad to have you here at Healthy Bump Club. Before we get into the details of it all, please do us a favor and go ahead and click the subscribe button if you have not subscribed before, and welcome to our community. And also, if you really like our content, go ahead and hit us a like, share our content. And if you really feel motivated, go ahead and give us a thanks. I appreciate you guys joining me today. Now let's get into it because we got a lot to talk about. Hey, you guys. So the hepatitis B vaccine and the decision whether or not to continue with universal immunizations of newborns was the hot topic of the week. And in fact, it has caused just great outrage, lots of confusion as the decision of the ACIP committee rolled out. So that you guys know, the decision to implement universal immunization started in 1991, and the result of that policy caused a plummeting of the cases of infants infected with the hepatitis B virus. It was said that the number of cases in the 1990s, when the policy was initially implemented, was as high as 16,000 cases per year. Since the implementation of the policy, that number has plummeted significantly to now barely 1,000 per year. In fact, some sources say, depending on which population of peds you're looking at, the cases can be as low as less than 20 cases per year. So needless to say, we have documented proof that this universal implementation of immunization against hepatitis B at birth for newborns has had significant positive outcome in the reduction of the cases of infants affected by this virus. Now, one of the things that you should know is that there is also universal screening for hepatitis B for women who are pregnant, but there are some caveats that you should know about that. Yes, there's universal screening recommended for pregnant women at the beginning of the pregnancy. And so one of the criticism of the recent decision to abolish or do away with the previous policy, and the ACIP, which is the Advisory Committee on Immunization Practices, decided to do away with the 1991 policy, and now is saying that the decision to immunize a newborn should be up to the parents to have a discussion with their physician or their healthcare team. And if they do decide to immunize, their recommendation is to consider delaying for at least 2 months. There has been significant pushback as a result of this decision because one of their logic is the fact that pregnant women are being screened at the beginning of their pregnancy. Well, here's the caveat to that. One is that 14% of women are not screened or miss their screening, right? Or never get screened for whatever reason during their pregnancy. The other caveat is the assumption that pregnant women are not sexually active, which is one of the ways that you can acquire the infection. Now, it's not just sexual activity, it's also transmitted through body fluids. And the very kicker about this particular virus is the fact that it doesn't require a high viral load to infect the next person. So even something as simple as a scratch, as a microscopic drop of blood, can result in the transmission of the virus. And the virus has the ability to live on surfaces for weeks, so resulting in an infection of an unknown adult. And the other thing that you should know about is that up to 50% of people who are actively infected with hepatitis B don't even know it. And that's part of the problem. And so your assumption is that a woman who is screened negative at the beginning of her pregnancy will remain negative at the end of her pregnancy. And even if you were to say, well, let's rescreen women at the end of the pregnancy, which is something we do for certain infections, depending on the risk factors like HIV, gonorrhea, and chlamydia. Well, here's the thing. One of the things we check for to identify acute infection is a hepatitis B surface antigen. And that surface antigen may not appear for 1 weeks after infection or exposure occurred. And the other thing that we know about hepatitis B, outside of it being highly infectious, is the fact that to even develop symptoms can take a very long time. Some people may not develop symptoms for 6 months after they've been infected. The other thing that we should also keep in mind is that hepatitis B is a leading cause of liver disease and also liver cancer worldwide. And 9 out of 10 newborns who are infected with hepatitis B will develop lifelong chronic infections. It is said that 15 to 25% of those newborns will then eventually die as a result of hepatitis B. Currently, liver cancer is rare in kids resulting from hepatitis B because of the immunization policy. The other thing that people should be aware of is the fact that while we had a 95 to 99% reduction in the infection rate of kids being affected by hepatitis B, we also should keep in mind that those who received the vaccine were also 22% less likely to die from any other cause. So the vaccine had more benefits than the direct protection against the virus. We also know that the vaccine was highly effective. For newborns who received the vaccine and completed the full course, there was a 98% rate of them being protected for at least 30 years. The other thing that people aren't talking about when it comes to pregnant women is the fact that there is a false negative rate when it comes to evaluating for the infection. And so while we are saying yes, screen pregnant women, you have to account for the fact that there is a variation in the efficacy of screening depending on the test that's being used. Older testing kids have a false negative rate of 5 to 17%, while newer testing kids have less than a 2% false negative rate. And so you also want to keep in mind that rapid testing also has a variable rate when it comes to false negatives. So depending on the test that's being used by the clinic or by the facility, you may see variations in how effective the screening process is for pregnant women. So you may be asking, who made this decision that led to an 8-3 vote in favor of abolishing the current universal immunization policy? Well, let's get to know a little bit about the people who are making these major decisions. So you have Dr. Blackburn, who is a director of medication access and affordability. So Hillary Blackburn is a pharmacist and also has her MBA. Then you have Dr. Evelyn Griffin, who is an OBGYN. Listen, as much I appreciate the incorporation of OBGYNs on this panel, we are part of the process, but I would prefer to have my pediatric colleagues have a much greater voice in this decision making, and perhaps our infectious disease colleagues and our epidemiologists than our OBGYNs. Okay, because we're not treating the outcomes, but we are involved in the screening. So I do think we need to have a voice when it comes to the screening process, just to discuss the realism of some of the policies that are made, but we definitely don't need to be a primary voice. And then you have the psychiatrists and psychiatrists and neuroscientists, Dr. Joseph Hebel. I'm not sure if that's Dr. Joseph Hebel. I'm sure I may be mispronouncing that last name, and I apologize for doing so. Then you have Dr. Levi, who is a professor of operations management at MIT Sloan School of Management. That's a little bit weird for me, but okay, he's a leading expert, they said, in healthcare analytics. Then you have a professor, Dr. Robert Malone, and Dr. Robert Malone is an adjunct professor at Pennington Biomedical Research Center in Louisiana, State University. Then you have Dr. Cody Meisner, who is a previously chief of Division of Pediatric Infectious Disease at Tufts Medical Center. Okay, I think we have a voice in the building. Dr. Kirk Milhone, who's a medical director for Hearts and Souls Free Medical Clinic. Dr. Milhone is a pediatric cardiologist and a former U.S. Air Force flight surgeon. Thank you for your service, sir. Um, However, I'm not sure that this is the most appropriate person to be on the panel for this particular discussion, but that's just my humble opinion. Then you have Dr. James Pagano, who's an emergency medicine physician. Again, I appreciate your service as a colleague, but I'm not sure an emergency medicine physician is really the appropriate voice for this particular discussion. And then you have Dr. Vicky Pebsworth, who is a PhD RN and focused on bioethics and vaccine safety. Okay, yeah, sounds good. And then you have Dr. Raymond Pollock, who is a surgeon transplant immunobiologist. Okay, an immunobiologist sounds appropriate. I'm not sure a transplant immunobiologist. I'm not sure about that, but definitely I can understand that. It looks like Dr. Raymond has been a principal investigator on NIH transplant biology grants and numerous drug trials. Okay, so definitely some relevance there. And then you have Dr. Catherine Stein, who is a professor in the Department of Population and Quantitative Health. One thing I will say, one of the common criticism of this panel is that apparently I don't know them personally or specifically or professionally, but the public opinion has been that many of these panelists have a known anti-vaccine perspective. And I don't know to what degree, I don't know that information, so I can't share that with you today. But I did want you to have some ideas to who is on the panel. So who voted against this decision? Because that's important to know too, right? Who voiced dissension against abolishing the current policy. And one was Dr. Raymond Pollock, who's the transplant immunobiologist. The second person was Dr. Cody Meisner, H. Cody Meisner, who is the previous chief of Division of Pediatric Infectious Disease. So you have two experts when it comes to immunology and infectious disease and the pediatric population. And then the third person who voted against it was Dr. Joseph, the person I keep messing up his last name, but Joseph Habel, who is the psychiatrist, neuroscientist, former chief of the section of nutritional neurosciences. So those were the three dissenting votes against the decision to abolish universal immunization of hepatitis B in the pediatric population for newborns at birth. And so before this particular opinion or recommendation becomes fully implemented, it has to be approved by Jim O'Neill, who's now the acting director for the CDC, and the secretary of the HHS, which is RFK Jr. So the understanding is that they're going to approve since it has been understood that RFK Jr. has been on a mission against vaccines in the US. So it's pretty much anticipated that it's going to be approved. So now that you have this information, it's really up to you to make the decision as to what is appropriate for you and your child. And I suggest that you really have this conversation with your healthcare provider about the prevalence in your community, just the ease of getting infection. It's really important for people to understand because while birth is one of the most common ways that the infection is transmitted, and it's transmitted vertically, it's also important to know that a lot of the infants that were infected with the disease were infected by other family members, infected by caretakers, which there has been a recommendation to ensure that anyone who's caring for newborns are not actively infected and preferably are immunized against hepatitis B. But this is why it's important because it's so easy to transmit on surfaces, as I mentioned, takes a very microscopic amount of bodily fluids or blood to transmit the infection. So someone could have had a manicure and have a slight injury from the manicure, right? And is taking care of your child or holding your child, that infection can be easily transmitted. And also in daycare centers, right? So if another child is infected, it can easily be passed on to another child or by the daycare provider or daycare staff. And so this is why this is why so many daycares also assess immunization when it comes to certain types of infection, because it's so easy for it to be transmitted either from staff to children, vice versa, or from children to children. So keep that in mind. I hope this information helps you in your decision. Now, let's talk about another policy that you should be aware of. Now, I'm sure many of you have seen the very disturbing viral videos of particularly two pregnant Black women who were in labor. And there are way more stories than what these viral videos represent. But I'm sure you saw, especially the one in Texas with Miss Carrie Jones. Also, I think she goes also by Kiara Jones. Correct me if I'm wrong. But you saw the disturbing video of her being in labor, being asked very standard admission questions while she's actively in labor. The outcome of that particular situation was that that nurse, who was who lacked so much sympathy for Miss Jones, was fired. And I'm sure some of you may or may not have seen the second video, which came out soon after and became viral also, of Mercedes Wells, who was also in labor. She was in labor at Franciscan Health Crown Point Hospital in Indiana. And you see in that video, she's there with her husband. She's very obviously in active labor. Or if you're not quite sure what active labor is, you can at least deduce that she is acutely in a lot of pain, and her pain is not being addressed. Instead, she was discharged from the hospital and within minutes gave birth, unfortunately, in the truck with her husband to their newborn, beautiful baby girl. The first case I should mention, the one in Texas, that child was also noticed to have meconium stained fluid at birth, according to her mother who was with her, who's the person who was recording the incident. Meconium stain is a sign of fetal distress. It is the first stool that's passed by a newborn, oftentimes when they are experiencing some type of stress or hypoxia. So, or lack of oxygen. So with Mercedes' case, coming right after that other viral video from Texas, it was really disheartening to see, and in some ways, once again, vicariously traumatizing for Black women. Nonetheless, they do represent and are a sad reminder of the state of Black maternal health and maternal health in general. Um, so there was someone in the comments also when I did my own video in response to what I saw with the case in Texas, said, well, this is not just a Black thing, it's about all women. And while I do agree that there is a crisis when it comes to maternal health across the board in the US, I will not undermine, minimize the disproportionate experience of Black women in this country. And so while your point was valid in the sense that it is a universal issue, your point was not valid in its lack of recognizing that these types of experiences disproportionately affect Black mothers. But thank you for commenting. That being said, so this, as you know, Mercedes' case, as well as Miss Jones' case, have really started lots of conversation. And with Mercedes Wells' experience and the experience of her husband, Leon Wells, who's the one that posted the video, it resulted in what's called now the Wells Act. So let's talk about the Wells Act. So Representative Robin Kelly, who is not new to maternal health, I should say, saw the video that we all witnessed and was inspired to write the Wells Act. So, what you should know about Representative Robin Kelly is that she is the chair of the Congressional Black Caucus Health Brain Trust. She has a prior act that was introduced to Congress, which is the Care for Moms Act. The Wells Act is a woman expansion for learning and labor safety act. So what you should know about this act is the focus on of this particular Wells Act is really on that decision-making process that occurs when a woman is in labor or coming in for evaluation of labor to ensure that there is a safe discharge process. And so this particular act urges the hospital to develop and implement a safe discharge labor plan policy. And this policy has to include a few things. There's an expectation that there's a clinical justification for the discharge and that there's an assessment of travel distance, identified backup hospital or birthing facility. There's a verification of reliable transportation, documentation of the patient's understanding, and racial bias training for healthcare professionals. Now, while I love the fact that there is an effort to address a situation that is urgent, I would say it's disheartening to think that these very basic common sense things have to be made into a law. The other thing that I wish Representative Robin Kelly, if you're listening, the one thing I would like you to include is the assessment of the safety of laboring at home for moms. Because not every person has a safe environment or environment that's conducive to laboring in the early phase of labor if she's being discharged home. Can you do that for me, Representative Kelly? I would really appreciate that as we are addressing racial disparities, that we understand that some of those disparities extend to the home environment and that the home environment is not always one that is conducive to a healthy laboring process for all members of the population. I appreciate y'all. Thank you for considering my input. Anyway, moving right along. So this particular Wells Act builds off of Representative Kelly's Maternal Health Quality Improvement Act of 2022. Also, Representative Kelly reintroduced her Care for Moms Act, which is a comprehensive package that supports the maternal health workforce, that promotes access to prenatal and postpartum care, provides resources for mothers and babies so that they can thrive. And I will also like to bring a reminder or attention to the Momnibus Act, which was also not passed, but was introduced to Congress and has multiple pillars of action plan that really addresses specifically the disparity in maternal health care. So while I appreciate these overarching health policies that address maternal health as a whole, there is still a need to address disparities, and the Momnibus Act is directed towards that. So I want to also bring attention to the work of some of our other congressmen and women who brought forth in addition to the support of our former Vice President Kamala Harris, the Momnibus Act. So keep that in mind. Now, there's still another act you need to know about when it comes to this travel season and the chaos at the airport. Let's talk about it. So are you guys familiar with the Babes Act? I love the title of this particular law, but this is the Bottles and Breastfeeding Equipment Screening Enhancement Act that was passed by Congress in November. The act was initially approved and passed by the Senate in May of this year, and then passed by the House on November 17th of this year, and was signed into law on November 25 of this year. What the Babes Act does is that it aims to really make the air travel so much easier for parents by requiring TSA to implement consistent hygienic procedures for screening breast milk, formula, and feeding equipment, including necessary cooling items. So let me give you a little bit of history regarding this. In 2016, it was determined that breast milk and formula would be exempt from the 3.4 ounce liquid rule by TSA, right? So they were considered to be exempt, as well as breast pumps were also considered to be exempt when it comes to carry on limitations. The problem was that this law was not really carried out very well by TSA, and there was lots of inconsistencies across the country, leading to frustration of parents, delays in their travel experiences, unpleasant experiences, and sometimes even discarding of their milk, of the breast milk, or discarding of the formula. And so there was a need for change or a further implementation or a law that really requires some consistency in the training of TSA and the carrying out of these procedures to ensure that parents can have a very safe experience and not have to be compromised by their travel. The other thing that I really liked about the updated law was the fact that it also gives allowances for the transportation of these items in absence of the baby. So this is great for my career moms who are out, who have to travel for their jobs or for other reasons and don't want to have an experience that interrupts their breastfeeding, where they have to discard their milk or they have to figure out ways not to pump. So it's really good that the law was expanded or updated to also allow for that particular scenario so that you know exactly how this policy works out. So, bottles and breastfeeding equipment and cooling packs, in order to preserve the breast milk, are allowed to be screened. Now, you do have to declare that you have these items so that you can undergo the proper screening process with the x-ray, or you can request to be exempt from the x-ray and then choose to have alternative screening process such as swabbing of the milk. And again, I must reiterate the fact that breast pump is not considered to be a carried on, is not considered to be a carrying on item. So it doesn't count against your carry on item limitation. So it should not, no one should be counting your breast pump as a carry on item that meets the limitation requirements by by TSA or the airlines. So thankfully, with the advocacy of representatives like Eric Swalwell from California, and two representatives from Florida, which is Maria Salazar, as well as Anna Paulina, and from Colorado, we have Brittany Peterson. While in the Senate, the support for this law was really pushed forward by Senator Mazie Hirono and by our Senator Tammy Duckworth. Tammy Duckworth is a senator from Illinois, while Senator Hirono is from Hawaii. This was really a bipartisan bill and had unanimous support. So it shows that we can work on things that we all agree are a priority. The update is to really ensure that there are guidelines for screening process with TSA. There's a continual training process that is expected to occur so that you can minimize the mishandling and discarding of milk, as well as clear communication with parents so that they know what to expect in the process and that they need to declare these items and then what their options are in the screening process. So as we talked about babies, let's talk about Baby Chance. Do you guys remember Baby Chance? Well, you may not recognize the name Baby Chance, but you may recognize the name Adriana Smith. Do you remember the name Adriana Smith? She was the Black woman the beautiful mom, who unfortunately was declared with brain inactivity, fill in the blanks. And she was in her first trimester of pregnancy. And due to Georgia's Life Act, which is the Living Infants Fairness and Equality Act, which bans ABs after 6 weeks, she was kept on life support for the duration of her pregnancy. Her pregnancy concluded as an emergency C-section, delivering a 25-weeker who was 1 pound, 13 ounces. Now, this case had lots of pushback for the very obvious reasons: the use of a woman's body without her consent, to be a live incubator has definitely been the source of lots of debate, and very passionate debate for the obvious reasons, especially when you look at historically and how Black women have not had a lot of autonomy historically when it comes to the healthcare system and our bodies. And so since then, so she gave birth to baby Chance. Her mom, April Newkirk, gave her a recent update to notify the public that baby Chance, who was born on June 13th, 2025, so earlier this year, has remained in the NICU until now and is being relocated to another facility that has the specialized care necessary to continue his fight for life. He is now 11 pounds and has remained in the NICU this entire time. While the family was not a part of the decision to keep her on life support, they are, however, being held responsible for all of the hospital fees. So that means all of the intensive care that Adriana received while she was kept on life support to the intensive care that baby Chance has received since he was brought into this world. So if you know anything about our healthcare system, you know that that is a very expensive bill. And this is something that can result in bankruptcy or financial devastation to families. And so that's why her mom, April Newkirk, has started a GoFundMe. So feel free to check that out if you feel compelled by your sympathy for this family and their circumstances. Make sure you check that out as well. And we will continue to keep baby Chance in our prayers as he endures this grueling process of entering the world and fighting for his life every single day. We're praying for you, baby Chance. So while the story of baby Chance took place in Georgia, let's talk about another state that's doing too much. And I got a lot to say about this one. Okay, North Dakota, you're up next. So did you guys know that there was an appeal for North Dakota's AB ban? And so recently, there was a decision by North Dakota Supreme Court to uphold this near total ban for ABs in the state. Now, the state does give exemption for the mother's life, and it does give exemption for rape and incest, but those exemption includes a clause where the AB has to occur before 6 weeks. And the pushback has been that most women don't even know that they're pregnant by the time they're 6 weeks pregnant. And so the clause or the exemption for ABs for those who are affected by rape and those affected by incest is really unreasonably limiting. And that's been the criticism of that particular law. The consequences for any physician or clinician who has performed an AB that the law that is deemed outside of the provisions of the law can face up to 5 years in prison and $10,000 in fines. And so that essentially makes the performance of an AB a felony in the state, aligning with a number of other states that have made similar decisions. Did you know that there are states that are getting an F? Let's talk about it. So you guys, the March of Dimes is not playing with the US. In a recent report, when it comes to preterm births in the United States, the March of Dimes gave the US a whopping D+. Y'all, we have got to do better when it comes to preterm births with a rate that is still 10.4%. In fact, that rate has gone up. It has not gone down. It has not even plateaued. And so that's why the US is getting such a poor rating when it comes to preterm births. But there are some states that stand out for the wrong reason, and they are on the March of Dimes naughty list this year. And those states are primarily in the South. What's going on in these southern states? We need to talk about that maybe a little bit more. And perhaps one of the issues is that states like Georgia dismantled their maternal health committee. And so there's no one really tracking these outcomes. Perhaps that's part of the issue. But let's talk about which states got a poor rating from the March of Dimes. So Mississippi got an F. Louisiana, you got an F. Georgia, you got an F. Other states that got a D or an F include Arkansas, Alabama, and Texas. But there are states that are doing amazing work, and we also want to highlight those states, right? So, New Hampshire, good job. You guys got an A minus from the March of Dimes, and that's a great rating. That means you guys have figured out what we need to do, and you're doing it well. Congratulations to New Hampshire. Now, while New York is not on the failing list when it comes to preterm births, it is certainly not doing well when it comes to HIV. New York, you're up next. Let's talk about it. So not only is New York on this list, but Georgia, you are still on this. What is going on in Georgia? You guys are still on this list as well when it comes to HIV infections. So unfortunately, Georgia is the number one state in the US when it comes to HIV, new cases of HIV, and particularly disproportionately in certain counties like Fulton County, according to Morehouse School of Medicine. Georgia leads other states with new diagnoses, upwards of 2,400 new cases in 2023, most of which are resulted from Black men who participate in MSM. So that's men having sex with other men. That's where these high rates are coming from. In fact, Morehouse says that the bulk of these new cases are as a result of new cases in two populations, Hispanic and Black men. But New York, we have to talk to you too, because while in prior years, New York has actually seen a decline in HIV, in most recent years, there seemed to be a new rise of HIV cases in New York, especially, particularly New York City. In fact, there was an increase of 7.6% rise in 2023 compared to 2022. And in 2024, the new report that just came out showed that there was another 5.4% increase rate compared to the year before in 2023. So what's going on in New York? Let's talk about it. But we also, while the cases in Georgia has been predominantly MSM, Black men and Hispanic men, we got to take a moment to talk to Black women as well. Because sisters, you are the disproportionate and overrepresented percent of cases in women in the United States. And particularly sisters who are in heterosexual relationships. So my sisters, I got to talk to y'all. We've got to do better. If you're in a situationship, you may want to consider getting on PrEP. PrEP is a prophylaxis that helps to prevent the acquisition of the infection and is highly effective in reducing the acquisition of HIV through sex. When it comes to sex transmission, it reduces the risk of transmission by 99%. And when it comes to drug abuse, it reduces and the sharing of needles, it reduces that rate by 74%. So PrEP is very effective. So sisters, while you may be currently HIV negative, you may also consider yourself to be HIV possible, which means you're in a situationship or you live a lifestyle that increases the likelihood that you may become infected with HIV. And that includes your personal practice, but includes also the practices of your partner or partners. It's important to keep that in mind while you may be taking precautions for your lifestyle. If you're with a partner that is not taking precautions, then sisters, this is why our rate is so disproportionately high. We overrepresent in the percent of new HIV cases. That is an epidemic amongst Black women. So while the brothers are leading in the number of cases in states like Georgia, we can't just keep looking at the brothers. We've also got to take responsibilities for ourselves. Okay, and one more topic before we go. Let's talk about these premiums, y'all. So yes, recently I shared with you guys that the tax credit for the ACA, which is the Affordable Care Act, is expiring. And Congress decided, despite the pushback from the Democrats, not to extend these tax credits. And so I just want to give you an update on this conversation when it comes to the Affordable Care Act and the tax credits that are now officially going to expire. That means at minimum, people will experience a increase in their premiums that may be doubled, and it's expected that the far majority will see much higher premiums than that. So the KFF, which is the Kaiser Family Foundation, it is an independent source of health policy research, did a recent survey looking at the responses or the plans of individuals when it comes to the marketplace enrollees. And so marketplace enrollees may consider different health insurance options if premium payments really do increase as expected. So with their recent research, they did a survey and they asked marketplace enrollees what their plans are when it comes to this increased premium or these expected increased premium. And they spoke to them with the anticipation of at least a doubling of their payments. And so they looked at the data by looking at the percentage of individuals who are currently part of the marketplace who will be looking for a different marketplace plan with a lower premium, but which may have higher deductibles and copays. You guys know how that goes. And so about 32% said that it's very likely that they will look for another plan, and 38% said it's somewhat likely that they will look for another plan. Then they asked the critical question many of us want to know: what percentage will decide to go without healthcare insurance? And they found that 25% are very likely to go without healthcare insurance. And 27 said somewhat likely that they will go without healthcare insurance. That's a huge percentage, you guys. We're talking about millions of people. So 25% of millions is a very large percentage of our population. They also asked what percentage will look for a different job that provides health insurance that meets their needs. And about 15% said it's very likely that they need their health insurance, and they are willing to change their jobs, even in a job market that's not doing very well. So keep that in mind. And 29% said it is very likely that they will be looking for some other form of employment so that they can afford their health insurance. What percentage will continue with their current plan and pay the higher monthly premium? 10% said it's very likely they will do so, and 30% said it's somewhat likely that they would do so. So people are really facing some very hard decisions. And another data point that they collected, which I thought was really important, was the fact that 60% of those surveyed said that they find it hard to afford out-of-pocket costs like deductibles and copays. So 60% of individuals, even as they currently have a healthcare plan, are struggling to afford their copays, co-insurances, and deductibles. In addition to that, many said that they cannot afford a $300 annual cost increase without disrupting their ongoing finances currently. We're literally saying that many people have declared that even increasing their healthcare costs by $25 per month could cause a disruption to their finances. That's just to give you an overview of where we are currently, you guys. So people are having a hard time financially with their employment. And this survey, thank you to KFF for bringing this to our attention, is really just highlighting even more so how health insurance is a dire situation in the United States, and there is need for better policies so that our population can afford their health care and not go into the hole financially or have some financial financial crisis as a result of these healthcare policies. So unfortunately, with the expiration of the tax credit, millions of Americans will possibly experience financial hardships, and that's important for us to pay attention. So, that being said, I thank you so much, guys, for joining me today. I hope I've added some highlights and clarified some confusion on these internets. Did your state do well? Is your state on the naughty list this year? Are you on the naughty list this year? But I hope that this information will help you get off the naughty list and get on the good list. You and your states that you live in, you are the voice that drive policies in your local governments. So you make a difference when it comes to maternal health. You make a difference when it comes to HIV cases. You make a difference when it comes to how moms are treated when they're in labor. Your voice is important. And I hope, if nothing else, this information empowers you to know how important your voice is locally and not just nationally, because local determines what happens nationally. So this is Dr. T, the hand behind the handle of Healthy Bump Club, right here on YouTube, and healthybump.club on Instagram. I hope this information has brought some clarity to you guys. Kudos to the parents who hopefully will be having a much easier experience as you travel during this holiday season. I hope that these new guidelines will bring you some ease in that whole process. So thank you guys for watching, and I hope to see you guys when the next episode. Ding, 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 ding. I'll see y'all next time. This is Dr. T. Just a friendly reminder, don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.